I'm going to talk about Medicare explained, so stay tuned. I'm Keith Armbrecht, founder of Medicare on Video. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Turning Medicare eligible is actually a very good thing. You'll likely find Medicare to be a much better alternative for your health insurance needs than what you may have had previously. But there are some choices. So I've created a Medicare Resource Center where I have a complete video library on everything Medicare. You'll also find all the necessary links and the guides and the forms that go along with them. So after this video, take just a few minutes to explore our Resource Center. I'm sure you'll find everything that you need for Medicare. You can also get an immediate quote for your Medicare supplement insurance. Just fill in your basic information and it'll bring up the rates for the plans that are available in your area. It would also be a great idea to subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So again, I hope you find this information very helpful, and please let me know if I can help. Okay, let's now do just an overview of Medicare. So this is Medicare Basics. I'm going to try and make this short and simple and easy for you to understand. So this is a great place to start. If you're just coming into Medicare, maybe you're turning 65 and you're going to be entering Medicare and you kind of need to understand how it functions, or you're still working and you're about to retire and maybe you're 67 or 68 and your group coverage is going to end. And as long as you have not started your Medicare Part B, as in boy, it's exactly the same as when you're turning 65. So when you come into Medicare, you have two routes there. Either turning 65, you start A and B, or you continued working past 65. A already started for you because it's automatic and that's okay. And then B is the one that is up to you to initiate. So you want to make sure you contact Social Security to initiate your Part B. So we'll go over through that and I'll show you exactly kind of how Medicare functions. So again, this is going to be nice and simple and a great place to start when you're coming into Medicare. So let's talk about understanding Medicare. And this is coming right from the Center of Medicare Services guide. So straight from the horse's mouth, this is what we need to know about Medicare. So what is Medicare? Medicare is health insurance for people 65 or older, or people under 65 with certain disabilities, people of any age with end-stage renal disease. So there are kind of four different main parts of Medicare. You have A, you have B, C, and D. So let's figure out exactly what those mean and how they work and what you need to understand. Part A, Medicare Part A. Again, Medicare Part A starts automatically when you turn 65, or it may factor in if you have disability under 65. But for those turning 65 or retiring, Medicare Part A is automatic. There's no cost to it for you. So it's going to start on the first of the month of your 65th birthday. And what Part A covers is inpatient services. So it covers the hospital, the building is kind of how I describe it. So if we look at A as covering the building, and then Medicare Part B covers the people in the building. It covers the doctors, outpatient surgery, things that are not part of inpatient coverage. So when you look at the two, pretty easy to understand. Part A covers the building, Part B covers the people. Now Part B is a choice. So you need to initiate Part B, and there is a premium to Part B, so you will be paying a premium. Right now, it's $134 a month, and if you're drawing Social Security, that will come out of your Social Security check. If you are not drawing Social Security, they will send you a bill for your Part B coverage. And something that surprises people quite often is when you're not drawing Social Security and they send you a bill, they're going to bill you quarterly. So you're going to pay it 3 months at a time, and then you won't get another bill till that 4th month after that. So keep that in mind. It's certainly important to understand that. Now Medicare Part C kind of changes everything in Medicare. Medicare Part C, and I don't know why they kind of line it up this way, but Part C is what is called Medicare Advantage. So I'll show you on the next slide kind of your two routes. You have two routes when you come into Medicare. Either you stick with original Medicare, A and B, or you choose to go into a Medicare Advantage plan. And Medicare Advantage plans in kind of large metropolitan areas may be something that works for some folks, but it does bring you back more to an HMO type environment where you have a network of hospitals, you have a network of doctors, you have to stay in that network of doctors. There are different levels of plans. Some may require a referral to go from a primary care to a specialist. It's certainly far and away where you see most of the dissatisfaction in Medicare is within Medicare Advantage, because you give away some of your flexibility and some of your choice. So that's your first really important decision, is whether or not you're going to choose to go in a Medicare Advantage plan. So make sure you understand that as well. And then the next part is Medicare Part D. And that actually kind of lines up because it's D as in drug. So if you stay on Medicare Original, A and B, you would likely get a drug plan to go along with it. So a drug plan is a separate piece from Original Medicare. So you'd have A and B, and then you'd get a drug plan to go along with it. Not a big deal. It's pretty easy to manage. It works a little differently, and I do have videos on that, so make sure you kind of look through the videos on how Medicare drug plans work. If you are in Medicare Advantage, most Medicare Advantage plans include a drug plan. So, you know, it's kind of all wrapped into one, but a lot of folks kind of see the shininess on the outside when they go in, and then once they start to use an Advantage plan, that's when you learn kind of how things function. With Original Medicare, you can go to any doctor you want, you can go to any hospital you want, you can basically do anything you want, and if it's medically necessary, chances are Medicare approves it. So you don't have anybody else making your decisions, you don't have any insurance companies in the way. It's generally the most flexible way to go. So certainly the choice that I would take if I were choosing Medicare right now is I would be choosing Original Medicare over a Medicare Advantage plan. So here are your two avenues. And I have some other videos that kind of go into more detail and show you more specifically, so feel free to take a look at those as well. But you can see on the left side is Original Medicare, Part A, Part B. You would likely add a drug plan, and then you would also likely add a Medicare supplement plan. So when you talk about costs, what does it cost to be part of Medicare? So let's say you came in at age 65, your A and your B. We know your B is going to be about $134 a month. So not too big of a deal. Part D, prescription drug coverage, that can generally run $20 to $25 a month unless you are on a very complicated prescription medication drug plan. So regular drug plan, you know, basic drug plan is $20, $25 a month. So we'll look at the 134 plus 25, and I'll pull my calculator out here and we'll add this up as we go, plus 25. And then a Medicare supplement plan. Most people choose to get a Medicare supplement plan which covers what A and B do not. So there are some out-of-pocket expenses to A and B. Primarily on A, if you go into the hospital, remember A covers the building, there is a hospital deductible right off the bat, and it's about $1,300. So it's a pretty big deductible if you go into the hospital. So most people want to have that covered. Part B has a smaller deductible. It's only right now $183 when you go to the doctor. You're going to pay that first $183, and then it's 80-20. So kind of like the old days where you had, you know, as I recall, as a child, my parents had Blue Cross Blue Shield. Everybody had 80-20 insurance, where the insurance company paid 80, we paid 20, and that was kind of the way it worked. Now, the problem with that under Medicare is that 20% has no stop. So, for instance, if you have a $10,000 year, not too big of a deal. You'd be responsible for $2,000. A lot of money, but manageable. If you have a $100,000 year, now it's up to $20,000 that you're responsible for. God forbid you have a $1 million year, and then your part of it is $200,000. That's why most folks have a Medicare supplement. Number one, it puts a stop on it, and it pretty much covers what Medicare does not. So it makes things pretty simple. And a Medicare supplement, depending upon what part of the country and kind of what state you're in, because some states require additional benefits, which drives the premium up, but it will run generally between $100 and $120 a month. So it's not a crazy amount of money. So if we added 120, you know, now we're talking total $279 a month. So I don't know what insurance you might have right now. Unless your employer is paying the entire thing, chances are you're paying a lot more than $279 a month. And keep in mind that $279 is full coverage. So you'll have very little out of pocket when you come into Medicare. So Medicare is almost always a very positive enhancement to whatever medical insurance you might have right now. So that's a wonderful thing as well. So it's actually very good. Now, getting Medicare, let's run through this kind of quickly. And again, I'd be happy to help anybody. This is obviously what I do for a living, is I help people with their Medicare supplement plans, and there's no cost to you to use me as your agent, and that would give you access to me not only now but also in the future. So I become your service person for now and also down the road when things come up down the road, which, as we know, they always do. So you want to kind of have that bit of help when you need it. So getting Medicare, enrollment in Medicare Part A and Part B is automatic when a person turns 65 and is already getting Social Security. So if you're already drawing, if you chose to start Social Security at age 62, what's going to happen when you turn 65? A is going to start no matter what. So don't worry about A. Don't even think about A. B, they will send you a postcard that says, we're going to start it on the first of the month of your 65th birthday, unless you tell us not to. So the only time you'd probably want to tell them not to is if you're still working and you are on group insurance. You do not want your Part B to start. So I have people all the time that continue to work past 65 to 67, 68, whatever it may be, and their Part B started and they've been paying for it the entire time, and it's of zero value. So you absolutely, and then it also takes away some triggers when you come into Medicare. So if you are going to stay on your group plan, make sure your Part B does not start. So if you're under 65 and disabled, it will automatically start. And I don't do disability Medicare, and it's a completely different animal than regular Medicare, but I do want to help people figure it out. So I do have a video, and I kind of tell you about Medicare disability. So if you're under 65 and you're approaching Medicare due to a disability, take a few minutes and watch the video. It's on its own URL, make it easy for you to find. It's medicaredisabilityvideo.info. So make sure you go to that, and it'll show you exactly what to do and kind of how to take care of that. Now note, Part B is optional. Someone who does not want Part B to start must follow the instructions that come with the Medicare card. So again, that's if you're drawing Social Security. If you're not drawing Social Security, you're gonna have to call Social Security and tell them to start it on the first of the month of your 65th birthday, or when you're going to come off of your group plan. So a person must sign up for Part A and Part B if he or she isn't getting Social Security. That's what I just discussed. Has end-stage renal disease. So that's when you need to contact them. So if you're drawing Social Security, it's going to start unless you tell them not to. If you're not drawing Social Security, you have to call them and tell them that you want to start. You can also do it online, and I made a URL for that as well. If you go to www.startpartb.com, it'll take you right to Social Security's webpage where you start your Medicare Part B. So take advantage of that when it comes time. Write it down if you aren't going to be there for some period of time. Now, if someone doesn't automatically get Part B, this is when you can do your thing. So this is your timelines that you have to kind of understand. So initial enrollment period. A person can sign up when first eligible for Part B. Example, when you're turning 65, and it's a 7-month period. So normally, when you're turning 65, you have 3 months before the month of your 65th birthday, 3 months after the month of your 65th birthday. So it's a 7-month window. Really, you want to do it couple months ahead of your 65th birthday just to get it done and get it off your plate. So make sure that you kind of handle that, and I've got other videos that show you exactly how to do it. General enrollment period. If a person didn't sign up for Part A or B when first eligible, and if you miss it, this is what you got to now go through. He or she can sign up between January 1st and March 31st. So if you were supposed to sign up when you turned 65 and you didn't, now you have to do it between January 1st and March 31st, and then coverage is going to start on July 1st. So now you get into this whole time crunch, and you may need it before July 1st, but if you neglected your initial enrollment period, then you're going to pay a kind of a penalty for it, and it's not going to start till the July of whatever time you sign up between January and March. So special enrollment period. A person may decide to wait to sign up for Part A or Part B because he or she is covered by group health coverage. Now, that's absolutely okay. If you have coverage through work, you do not want to start your Part B until you're ready to come off of that coverage and go into Medicare. Now, what trips some folks up is, in order to not have a penalty on your Part B, you need to show them proof of credible coverage. So they're going to want to see proof that you had coverage through work before you signed up for your Part B, if you're now 67 or 68 or 69 or 78, whatever it may be. Now, group insurance counts as credible coverage, so that's no problem whatsoever. What does not count as credible coverage is retiree coverage or COBRA coverage. So if you retired from a company and you're 66 years old and you go on their retiree plan and you keep that for a few years, then all of a sudden you decide you want Medicare, you can get it Medicare, but you don't have credible coverage in between. So there is going to be a penalty on your Part B coverage. So make sure you understand that. Regular group coverage, absolutely stay on it as long as you want. And then when you're ready to come off of the group coverage, you start your Part B. Retiree coverage or COBRA, not the same thing. So you want to get off of that. If you're going to be in Medicare in the future, you want to get off your retiree, you want to get off your COBRA, end it, get into Medicare, everything will work out very well. Now, special enrollment period for international volunteers, a little different, so that's a little more specific. So that gives you a pretty good overview on the basics of Medicare. And again, there are obviously many different pieces, and I'm happy to help with all of it. I have a small team that is there to help you as well. So if you give us a call or visit my website at medicareonvideo.com, you can run a quote for a Medicare supplement right on the website. Just put in your basic information, and then we would be certainly very happy to help you. I'd certainly appreciate if you would allow us to help you with your Medicare supplement plan so we can continue doing this kind of thing for folks. I get a lot of wonderful feedback, and it's absolutely the most enjoyable thing I've done in my career. So it's something I will do from here on out. And I hope you found this information valuable. If you have any questions, I'd be happy to help. And I hope you have a fantastic day.